Welcome to Keys School Week 4. Hearing loop systems are available in all Asbury auditoriums. Evening events are live captioned, and most programs are also recorded for future viewing on the Keys School website. For program updates, check the various AV/TV communication options or the Keys School website. Didn't pre-register? Pay $2 at the door. Shuttles will run. Monday, September 30th, 7:30 p.m., Hefner Auditorium, Historic Preservation in Montgomery County. The presenter, Eileen McGookian, is the founder of Montgomery Preservation. This is Montgomery County's nonprofit historic preservation organization, encouraging and defending preservation efforts in local communities throughout the county. MPI works with all parties to ensure that towns, owners of historic properties, business and volunteer groups can step up to the significant challenges of the 21st century, while appreciating how historic places remain vital links to the past. This program introduces some local historic places and experiences in Montgomery County. Join us Monday, September 30th, 7:30 p.m. in the Hefner Auditorium. On Thursday, October 3rd at 7:30 p.m. in Parker Hall, 15 Years in Rwanda, Developing Young Leaders. The presenter is Robin Strickler. In strife-torn Rwanda, profound poverty, genocide, tragedy. Robin's deep commitment to education and leadership training works to transform young people into future leaders and problem solvers. In 2005, in a banana grove with 24 students, she started the Rwanda School Project. Now, only 19 years later, a campus with 7 buildings and 277 students. The school champions environmental sustainability and social progress in a nation, indeed a continent, that is rapidly changing. Robin's career in education evolved in the USA, Japan, and Rwanda. When she met and married John, a Rwandan Lutheran pastor who was born in exile in Tanzania, his educational experience strongly influenced her critical work. Some of you may already met Robin. Her mother, Virginia, was an Asbury resident until recently. We're eager to hear Robin's story. Thursday, October 3rd, 7:30 p.m., Parker Hall, for a truly inspirational lecture.
Welcome to Asbury View. I'm Pam Parmer, and today we're going to be learning about the invaluable and convenient audiology services here at Asbury. We're so lucky to have audiologists from the Family Hearing Center, which is part of TLC, the Treatment and Learning Centers in Rockville. I'd like to welcome Susan Yaffe-Oziel, Director of Audiology from the Family Hearing Center, and Dr. Michal Schimmel, one of the audiologists at the center. They regularly come to Asbury, and I think we should get started right away.
Great.
So, tell us, what does an audiologist do, and what services do you provide?
Go ahead. An audiologist provides services to individuals who need hearing evaluations, whether they have normal hearing or they suspect they have a hearing loss. An audiologist will do testing, evaluate the hearing, determine if there is any hearing loss and what recommendations can be made based on the hearing loss. And the services we provide at the clinic are testing, middle ear testing. We also provide services related to hearing aids, such as hearing aid fittings, recommendations, fittings, and counseling. And pretty much we follow that individual throughout their hearing process and hearing aid fittings to make sure that they're getting benefit from their amplification.
Okay. And so you mentioned that you do the testing and the middle ear testing in Rockville, so at the clinic. You can't actually do that testing here. But you can screen here?
No,
or?
we actually have a sound booth on campus.
Oh, I didn't realize that.
Yeah, in the Wilson building where we're located. Yep, so we have a booth. We can do the hearing test and the middle ear testing here.
Oh, really? Oh, wow. I had no idea.
Yeah.
Pretty cool.
Yeah.
And how would somebody make an appointment if they would like their hearing tested?
They could call our office. Our phone number is 301-738-1415, and our receptionist can assist them with scheduling a visit. They just need to let her know that they want to do the evaluation on Asbury's campus.
Okay. Wow, that is convenient. So I know there are tons of hearing aid manufacturers. And what hearing aid manufacturers do you work with, or how many do you work with, or what are the options that you present for folks who want to look at try hearing aids?
So we work with several hearing aid manufacturers. The hearing aid manufacturers we work with include Phonak, Resound, Oticon, and Widex. And depending on the individual's hearing loss, their lifestyle, a variety of different things based on their individual needs, we will make a particular recommendation to them.
And so each manufacturer's hearing aid has a little bit of a different sort of program, or I'm not even sure what I'm asking here.
No.
But there are definitely different manufacturers for different kinds of issues.
Yes,
Hearing issues.
I mean, they vary. Each manufacturer has their own programming and software, and we need to learn that software before we even fit the hearing aids. But it's really important to know that the ultimate goal is for the individual to be able to hear best in quiet and in noise. And so every manufacturer tries to reach that goal of giving the best benefit, especially in noise, where most individuals have trouble. But again, each manufacturer is different. And so when an individual comes in to have an evaluation, we will typically explain to them some of the differences between the manufacturers so they can be part of that decision making.
Good. Sounds good. And that's sort of how you tell what hearing aid is right for what hearing loss, or whoever your lifestyle and all the other things that go into that.
Yeah, absolutely.
That's good. Are hearing aids covered by insurance?
Sometimes. So what I typically recommend to my patients is to contact their insurance companies to see if there is any coverage. If they do require assistance with looking into their benefits, we do have an insurance specialist who works for our organization, so we can assist the patient with contacting her so she can look into whether or not there's coverage.
Right.
As of this interview, Medicare does not cover hearing aids.
Right.
There are some supplementary plans to Medicare that do have coverage, so it's worthwhile to investigate whether or not there's any benefit.
Is it right? Medicare does though cover the testing?
Yeah,
They just don't.
Right, exactly. They cover usually the majority of the testing, but not hearing aids at this point in time.
Right. Any word on if that's going to change, or
There was like
somebody must be lobbying for that.
Yeah, there was proposed legislation that got voted, voted down. That was I think a year or maybe 2 years ago. So I don't know that there's anything that's currently in place with Medicare, but
I'm sure it'll come back around.
Yeah, we'll see.
The baby boomers and beyond are
Yeah.
a large population to confront.
No,
That'd be nice.
I do believe that it's going to come back around. Yeah,
It's just going to take a while.
plenty of lobbyists.
Right. AARP must be doing something.
Yeah, yeah.
You know. How long do they typically last? So we're talking like somebody gets fitted with state-of-the-art, wonderful, amazing, shockingly technical hearing aids, and they last for how long?
They typically last for about 5 to 7 years. You can get maybe up to 10 years of use out of them if you're taking very good care of them. Usually, once you reach the 5 to 7 year point, there might be enough of an advancement in technology where it might be worthwhile to consider upgrading.
It keeps advancing.
Yeah, just like like your computers and your cell phone and everything.
Right.
But they really, usually there's enough of a technological leap at that point where it might be worthwhile investigating if it's something that can improve your hearing.
Right. And how often would somebody need to come back to sort of fine tune or work with you all to make sure they're getting what they hope to get from their hearing aid?
So usually people, on the first year, people will come in like 2 or 3 times, and then yearly after that.
So like initially sort of.
Right. So there is a whole process for how the fitting goes, and I can go into that too. So pretty much when you get fitted, you come for the initial fitting, and that's when the audiologist programs the hearing aids, and they do some verification measures to make sure they're functioning appropriately, and where they go over how they work and putting them on, taking care of them. And then from there you have a trial period, which is on average about 30 days, maybe a little longer. And so we'll see you within the trial period, and that's the time you have the opportunity to determine whether or not you want to keep the hearing aids. And then from there, you may require some more fine-tuning, maybe more closely within the first year, so maybe you'll be in 1 or 2 more times in that year. And then after that, we usually see people yearly to check in, make sure everything's okay, maybe check their hearing, usually about once every 1 to 2 years. And if there has been a change in hearing, then we can make adjustments to the hearing aids.
I think just knowing, because my husband wears hearing aids, and we talk a lot about it, and I think it must be hard for somebody who hasn't been hearing for a while, or has been having difficulty hearing, to then hear everything, like birds, refrigerators, microwaves, and I think it's sort of a training that you have to do with your brain because people who don't have have hearing issues, I think your brain just tunes it out. You don't really hear it quite as much. So it must be a little bit of a learning curve when people
exactly
start.
Right. Yeah, that's exactly right.
No, you're making a good point about that, because that's really sometimes the reason why people give up on their hearing aids is that, again, think about it. They'll go for several years with a hearing loss, missing out on all these things.
And at first you maybe don't realize that you're missing out.
Because typically hearing loss is a gradual change. So you don't notice it as much, but then several years go by where you're not hearing maybe the birds or the refrigerator hum or different things, the wood creaking, in the house on the floor. So a lot of times what they'll do is they'll come in and they'll complain, I'm hearing speech fine, but I don't want to hear all these other things. And I always remind them, I say, this is what normal hearing people hear. And the more you wear your hearing aids, the more you'll adapt to those sounds. And sometimes people will say, or even the crunching of cereal when they're eating breakfast,
themselves.
and I'll say, I hear crunching. So again, it takes a lot of counseling and a lot of support, which is something that I like to believe our clinic really does.
Oh, I'm sure.
We're very good at that, and we pride ourselves in that, because the last thing we want to hear is someone bought hearing aids and then they're sitting in the drawer.
Right. And that's the last thing their spouse wants to happen too.
Exactly. Exactly. Yep.
So I'm sure you do that and work with people all the time with those issues, but I do know that sometimes is an issue.
A barrier.
So I don't know, Belinda, as we all know, is working a lot here at Asbury with issues of isolation and loneliness, and I know that there's a connection between hearing loss and those two things. I think recently what I read, though, is that there's also a connection between hearing loss and dementia, and I wondered can you educate your clients about that too, or explain how that happens?
Yeah, well, so to be clear, hearing loss does not cause dementia, which is a very common misconception, especially with all the attention this has gotten in the media. What happens when you have hearing loss is that you have an impoverished auditory signal that's coming into your brain, so you have to have increased listening effort to understand what people are saying, which can tax your cognitive resources. And like you mentioned, hearing loss can result in social isolation and withdrawal, which can have indirect effects on cognitive function.
Right.
It's very important for people who do have dementia and hearing loss that the hearing loss be addressed, because hearing loss can exacerbate symptoms of dementia. But again, it's not a causational effect.
Right.
Yeah.
Okay. Yeah, thanks for clearing that up. But I can see that not being able to hear would cause you to withdraw a little bit maybe, and not just sort of not bother. And I think it is really important.
Yeah, there's a lot of research that shows that that can be the case, and that's why it's so important to treat it if you do have hearing loss. Yeah.
Yeah. And it really is a situation where people don't really, I mean, I don't think GPs generally screen for people that can't hear. They say, or maybe they'll ask you, are you, I have never been asked by a GP if I hear okay. And so there's not an automatic, when you turn 60, you should have your hearing test. You should have a hearing test. Maybe that's another thing that AARP can advocate for too.
Yeah.
Because as you say, it's gradual and people won't notice for a while. And by then, it makes it harder to adjust, right?
Or they don't notice until a family member complains.
Right.
The TV's too loud.
Right.
Every time I talk to you, you don't respond. I have to repeat myself a lot. And yes, and it would be wonderful if at age 60 everybody, was required, not required, but it was recommended that people have a hearing test. We've worked closely with a lot of the GPs, a lot of the internists in the area to get them, to encourage them to recommend hearing testing to their patients, even if it's just a baseline test so that they have it for comparison later on. I think it's just very difficult for them. They're so busy in their offices, they're not thinking hearing loss. But we're trying, especially in Montgomery County in this area, to encourage them to recommend it, or at least ask, how are you hearing? Or if they pick up on a patient not hearing well in their office, to suggest that they consider getting hearing testing.
Okay, I was just thinking, I guess the other thing, especially for us here at Asbury, we have the loop, what's it called? Sorry.
The loop system.
The loop system.
Yeah.
That can be tied or connected to hearing aids if you're like in Hefner or Roseboro. But how's it different from a telecoil? What is it the same?
So
it's confusing.
It's confusing because those words,
I've heard both of those
words get used together a lot. So the loop is the physical system that's set up in the room. So it's attached to like a speaker. If you're in a lecture hall, instead of the sound coming from the speaker, there's actually a wired loop that they put around the perimeter of the room. Okay, and it leaks what's called electromagnetic energy. A telecoil is actually just a coil of wire that can be put, or that is incorporated in certain hearing aids that can pick up that energy, so that the sound goes from the system directly to the ear, and that cuts out on the issues of being far away from the speaker, the person who's presenting, let's say, or if there's background noise, it kind of gives the signal right to your to your hearing
Right.
aid and then to your ear. So there are manufacturers that we work with that have telecoil technology in their hearing aids. So I try to talk to my patients who are residents at Asbury, because the telecoil, the loop systems are set up to consider hearing aids that have telecoil. And there's no additional charge or anything like that. It used to be that all the hearing aids, for the most part, had telecoil, but due to size of the devices, a lot of the manufacturers want them to be, a little sleek, and and it doesn't add a lot of size, but but to minimize its size as much as they can, some of them have done away with that. So you do have to choose a device that does have it if you want to take advantage of that technology.
Right. And I know there's also Bluetooth technology, because my husband's, our television goes into his hearing aid. His iPhone goes into his hearing aid. It's pretty miraculous, really. It's great. I mean, we don't have to have the television cranked up,
Yeah.
the volume. I mean, I can just control the volume however I want, and he can hear no matter what.
Yeah, I'd
So
say
it's great.
most of the hearing aids now have Bluetooth in
Yeah.
them, unlike telecoil, which is something that we have to
Yeah.
be specific about. So it's great. Yeah.
And I mean, if you go out in public, in theaters, there's telecoil and
Yes.
the loop situation too. So
Some
many
churches,
options.
synagogues, theaters
Right.
in the area
Some
do have
museums.
that.
Yeah.
Yeah. And I was going to say the other thing is that a lot of times patients will say to me, well, I want to make sure that the hearing aid you get for me has Bluetooth in it so I can use my cell phone with
Right.
it. And a lot of people think they have to pay extra, like have a premium aid in order to get that. But even the hearing aids that are not necessarily the premium level, but more of the advanced or basic, all have that ability.
They just come with it.
Yeah.
Wow.
And for the Asbury patients, as Michal said, we're really conscious of ordering for them hearing aids that have a telecoil in them, because we want them to be able to use it with the loop system here at Asbury. Asbury's done a wonderful job in making sure there are rooms in the community for that. They're very conscious of the need to hear well.
Right.
Yeah.
Yeah. Well, pretty much. A lot of people wear hearing aids here.
Yes.
So
Yes.
it's good. It's a good thing.
It's a very good
Right.
thing. Yes.
So is there anything else that I should have asked that I haven't asked, or anything else you want to mention, or are we?
I don't. Was there anything else that you were
I'm
thinking?
trying to think. I'm not sure. You've asked so many good questions.
really
I
have.
think I think it's absolutely, well, I think it's really interesting. I mean, I think audiology is really interesting. So actually, maybe you, I'm a little curious. You have a bachelor's degree and a master's degree, and then there's also the AUD now.
Yes. Yes.
A doctor of audiology. So, and what's the year situation with that?
It's 4 years for the doctoral program after your bachelor's
Wow.
degree is. Yeah, and I think it's now the minimum requirement for audiologists entering the field.
And while you're doing that, can you work under supervision, or is it?
No, you're training for I mean, you're doing supervised clinical hours,
Right.
And getting experience that way. And then typically, your last year of the program is just supervised clinic. Yeah.
Did you go locally?
Yeah, I went to University of Maryland. So yeah, I went there for undergraduate and graduate school.
Right.
We have a great program.
But that was a change. When did that change? When did what was the AUD required?
I think 2012 was when they switched over to it being a requirement, and then people who have masters kind of got grandfathered in there. They still can have their license and they can choose to pursue the AOD if they want to. But yeah, now it's like I said, now it's required.
And is your bachelor's also in audiology?
In hearing and speech sciences. Yeah. So I knew.
Yeah.
Yeah, what I wanted.
You knew
to
from an early age.
do. No, kind of. As I went through school, I kind of discovered that's what I
Good.
wanted to do. Yeah.
Nice. Okay. Anything? If you can't think of anything else, we can wrap it up.
Yeah.
Well, I was just going to say one more thing about the AUD degree. A lot of times patients will, or individuals will, get their hearing tested and they might not realize that they're not necessarily seeing an audiologist.
Oh,
They might
yeah.
be seeing someone called a hearing instrument specialist.
Right.
There's nothing wrong with that.
Right.
But what I want to make sure they know is that the evaluation they get from a hearing instrument specialist is possibly not as extensive
Yeah.
as an audiologist will do.
Right.
And so consequently, if there's any kind of medical issue that arises, they might not catch that
Right.
in the evaluation itself. So that's very, very important to understand. And the last thing that goes along with that, which I've talked about in my talks here at Asbury, is that sometimes people are hesitant to have a hearing evaluation, but what they don't realize, it's not all about getting a hearing test so then we're going to say you need hearing aids. It's getting a hearing test so you can find out, do you have wax impacting your ear canals? Do you have middle ear fluid? Do you have any kind of medical condition?
And
that
you can tell all that from the testing.
we can do that, but then we can't diagnose the
Right.
condition other than that there may be wax, but we can at least say to them, don't get your hearing aids yet. Let's have
Yeah.
you see a doctor
Right.
and have a doctor examine you first and make sure that you are in fact only, I shouldn't say only, but
Right.
you are in fact not having a medical problem and you need hearing aids.
Right.
So I think that's important too. Sometimes
Very.
people hesitate to get tested, but that's extremely important part
Yeah.
of why we think people should.
Right.
Yeah.
And that actually then that makes me think of the other question. There are over-the-counter hearing aids, right?
Yeah.
So what about those?
So over-the-counter
They're
hearing,
way less expensive, I bet.
it's true. Well, although not
Depending.
yet, depending.
Yeah.
Over-the-counter hearing aids are for people who have up to mild and moderate hearing loss.
Oh.
So there's nothing wrong with trying them if your hearing loss is within that range, and that's another reason to get a hearing test,
Right.
So that you know, and then you can explore, what options are
Mm-hmm.
available to you. I mean, the purpose of them is to make hearing aids more accessible to the population,
Yeah.
because a big barrier to getting hearing aids, research has shown, is cost.
Mm-hmm.
And so that's why over-the-counter hearing aids got approved. So yeah, I think that for the person who falls within that hearing loss range and may feel more independent in technology, where they don't feel like they need an assistance from a practitioner, they want to just
Right.
kind of, because they're typically paired with a smartphone and you can do some of the controls yourself, although there's not as much of an extensive way you can program them, but there are certain things you can do. Then certainly, it's worth it to try that to help you hear better, because as we've mentioned, hearing is so important.
Right.
Communication is so important for all the reasons we discussed earlier. So, yeah, that's kind of how I talk to patients about that.
That's actually really helpful to know.
Yeah, and as Susan was saying, it's just never a bad idea to get a hearing test.
Right.
I mean, we know that there are changes with hearing related to age as early as your 50s, and so it just to even have a baseline so that you kind of know what to do moving forward, or even if it turns out that you do eventually feel that you're having enough of a struggle where you want to try hearing aids, then you can have all this, your hearing monitored, and we can kind of
Right.
start going with that.
Good. Okay. Thank you so much.
Sure.
It's been great. Okay. I really so appreciate you being here, and I love the convenience, and apparently they're here Wednesday morning and all day Thursday in Wilson. And Michal,
Yes.
you come primarily, and then maybe we'll see Grace.
So
and-
I'm here Wednesday mornings, and Grace Richards, who's been on campus for, we've determined, to like 10 plus years, is here all day on Thursdays. And so between the two of us, you can schedule a
great.
visit.
Great. Probably a lot of people know Grace.
Right.
Probably people are getting to know you too.
Yeah, Grace is amazing.
Okay, so that's it. You might want to, viewers, thank you for tuning in, and you might want to think about getting your hearing tested, whether or not you're noticing a hearing loss or not. But if you are noticing a hearing loss, if you're having trouble in conversation, or you feel like you're missing out on some things, or somebody's telling you that you're missing out on some things, consider having a hearing test. And the number is going to be on the screen. I have it somewhere, 301-738-1415. Even though they're conveniently here, you do have to call and make an appointment. So thank you for tuning in, and have a lovely day.